Richard Caselli, professor of neurology, Mayo Clinic, Arizona. The name of the article, Alzheimer's Disease, Scientific Breakthroughs and Translational Challenges. Well, this is a review article, and so we cover a lot of territory. This is not anything that is brand new or unique to our ongoing research, but really sort of a synthesis of the history of the disease and where we are in the present day. For example, it might surprise a lot of people to know that when Dr. Alzheimer first described the famous disease back in 1906, the initial patient was a 51-year-old woman who died a few years later. And it was only 70 years later that it began to be widely recognized that the rare disease that Dr. Alzheimer described was the same as the very common problem of what was being referred to as senile dementia. And so since the mid-70s, we've recognized that it's a very common problem, very high cause of morbidity and mortality, especially among the aged. So the point of the article is not only to review what's known, but as in telling any story, which details are emphasized influence a great deal our perspective of what the story is trying to tell us. And what's a little bit unique about the way we've portrayed things or described things in this article is, number one, respecting the early history of the disease and remembering that it was initially described in younger people. And there's very good scientific reason to get back to that focus and not abandon it. Number two, for very good reasons, a lot of emphasis has been placed on a particular pathophysiological aspect of the disease, which is the role that amyloid beta peptide plays in its pathogenesis. The protein that ultimately leads to what is considered to be that toxic peptide, however, is coded for by a gene that is highly conserved throughout phylogeny. It's present in invertebrates in somewhat slightly different form. It's present in all vertebrates. It's nearly identical in our closest evolutionary relative, chimpanzees. And so when we see a gene that highly conserved throughout phylogeny, it's a clue that there's something very important about that gene. Research to the present time has really emphasized the toxic effects of its byproducts, if you will, and I don't think has fully explored the potential loss of function of altered forms of the protein. What role does this protein normally play in our brain? It's possible that the deposition of amyloid, for example, might represent a reaction to something else. And it's only when that defense system is overwhelmed that we succumb to the symptoms of Alzheimer's and neurodegeneration. I don't know that we have enough evidence to say that that's the case, but given the number of failed therapeutic trials that are aimed at eliminating amyloid from the brain, many people in the field are sensing that it's time to broaden our minds and perspective just a little bit and at least consider other possibilities, whether they ultimately prove to be true or not. And so I hope that in the telling of the story that is Alzheimer's disease, we have broadened people's perspective a bit to realize it is not simply a disease of old people. And while there is something very special about amyloid and the role it must be playing in Alzheimer's, it's at least possible that the story is more than why is amyloid toxic. It could be that there are other aspects of it as well. I think two critical implications of this perspective. Number one, I believe that we really need to have a much greater emphasis on studying the disease in younger people. As an example, Somebody diagnosed with Alzheimer's disease who dies at age 85 and comes to autopsy, what we will find at autopsy typically is not simply Alzheimer's disease, but a number of different pathologies, including Alzheimer's disease, but that also include pathologies related to Parkinson's, stroke, a form of dementia called, a pathological change called the glial tauopathy, hippocampal sclerosis. There's a number of other pathologies in older brains, and these other pathologies do contribute to the severity of the dementia. In younger people, somebody dying, say, in their mid-50s with Alzheimer's disease, it is more common that it is pure. So one can learn, I think, more about the things which really drive the disease independent of just, well, you're just getting old, in the younger population. Whereas in the older population, while certainly it's been important, it's contributed a great deal to our knowledge, it's hard to divorce those findings from what we see just as a consequence of advanced age. I think the other major shift that has to occur is not to abandon our focus on toxic effects of amyloid and the potential therapeutic targets that might give us, but to explore other targets, the role that another salient protein, tau, plays in the disease, targeting tau, the role that identified risk factors in more prevalent cases, apolipoprotein E4, how we might potentially address that part of the disease. Are there functional roles that amyloid plays that, as I mentioned earlier, become overwhelmed in the process? And are there things that we can do to supplement normal amyloid physiology to prolong its effectiveness before it becomes overwhelmed by whatever is driving the disease? I guess one final thought. When one looks at the genetics of Alzheimer's disease, there are rare cases where there are mutations of the genes that relate to the deposition and production of amyloid, and that's the basis for the amyloid hypothesis for what's driving Alzheimer's disease. Apolipoprotein E, when it was first described, kind of violated that. It was not an obvious amyloid-relevant protein. But since then, it's been shown that there are both amyloid and non-amyloid related interactions that apolipoprotein E has that could potentially predispose to Alzheimer's. Since then, there's been a large number, more than 20 genes that have been associated with modestly increasing our risk for Alzheimer's that encompass a number of different mechanistic pathways, cytoskeleton, amyloid, cholesterol, immune system, etc. If we look at all the different genes that are known to contribute to Alzheimer's disease risk, they still do not account for the majority of the inheritability of Alzheimer's disease. And in studies that have been done, it has been shown that there are risk factors currently unidentified that exist on every single chromosome, and the risk conferred by each chromosome is linearly proportional simply to the size of the chromosome. In other words, it's possible to eventually develop Alzheimer's through a myriad of mechanistic pathways. If you now extend that to environmental factors that have been shown to predispose to Alzheimer's, diabetes, cerebrovascular factors, head injuries, toxic exposures, and so forth. Again, what we find is that there are myriad ways of tipping the balance against us that would make it more likely that a person would develop Alzheimer's. So what are we really looking at here? Is it possible that what we really need is a more individualized approach to therapy? That maybe for some people, a certain combination of environmental and genetic risk factors will lead to this final common pathway, and that those specifics might differ from person to person. We don't know this, and it could be that this is completely wrong. But at this point, I don't think that we have the evidence to say that it is wrong, and I do think that if one were to have an open mind about looking at this wealth of data, one would have to ask that question. And so I think we have a lot more work to do in that space as well.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.